Shouldn't surprise me.
Bada bing. Thank you, Chad.
Good morning. Who's that? 7273.
Thank you, sir.
Thanks, Reynolds.
Frank, just in the back. I'm going to pan over to the door. Okay? Okay.
No visuals.
I'm going to be able to hit this for just a second. I want to check, make sure the light's in the right spot. Thank you. For some reason, this is right.
Are you talking about the middle? There's a light out.
Oh, there is a light out? Oh, okay.
Oh man, we need a,
I was looking at
yeah, no, it's out.
using comments too.
Do we need to shift our lights?
No, no, that'll be all right.
She's.
Yeah.
Yeah,
I don't
get
think
that
we-
one, the flight setup is super, I mean, it won't, it's not available.
Or you can grab one.
Oh yeah.
Okay, whatever.
Yeah, Gary and I are out on a shoot tomorrow.
Good morning. Who's that? 6761.
Hi, this is Decima Lee from KCRG.
That's the main.
Good morning.
Good morning. We'll go ahead and start with the case counts. So today we have 467 new positive cases for a total of 6,843 positive cases in Iowa. 93% of today's positive cases are from the 22 counties where restrictions remain in place. We have 1,047 new negative cases for a total of 34,494 negative cases. Yesterday, we ran a total of 1,514 tests, and we have tested 41,337 Iowans for a per capita rate of 1 in every 6 Iowans. And the State Hygienic Lab has the capacity of 4,188 tests. 2,428 Iowans have recovered after having COVID-19 for a recovery rate of 35%. And today, I regret and I'm very sorry to report that we have had 12 more Iowans that have passed away as a result of the virus. We know that COVID-19 poses the most risk of severe illness for older and elderly adults and those with pre-existing health conditions. And the vast majority of deaths in Iowa continue to be among this very vulnerable population. Iowa's ability to expand testing is a critical component of our response to COVID-19. Testing ensures that we understand the levels of virus activity across the state, and it provides us a roadmap to identify and isolate those testing positive, conduct case investigations and tracing so that we can better contain the virus, and develop strategies to manage it for the long term. Because of expanded testing and Iowans' efforts to slow the spread of COVID-19, on May 1st, we will begin to loosen some of our mitigation efforts. A week ago, I announced the launch of Test Iowa, and that's a statewide initiative to dramatically increase our testing capacity for COVID-19. Any Iowan can go to testiowa.com and complete a brief assessment to see if they qualify for testing. Testing for now is prioritized for essential workers and people who currently have symptoms of COVID-19 or have been in contact with someone who has the virus or have recently been in an area where it's more widespread. But anyone can take the assessment at any time. In fact, it's really important that you do. The assessment also provides valuable information about what's happening in different areas of our state. By completing the assessment, you can help us better understand the virus activity in your community, identify and contain a potential outbreak early, and expand business openings in safe and responsible ways. And I'm so proud to say that Iowans have responded to our call of action. In fact, since launching Test Iowa, just last week, we have had 442,000 people who have visited the site. We have had 229,000 Iowans who have completed the assessment. The top 5 counties with the highest number of completed assessments are Polk, Lynn, Blackhawk, Johnson, and Dallas. Of those who completed the assessment, 65% are female, 35% are male, 6% were age 15 to 24, 34% are age 25 to 44, 39% of those completing are the age of 45 to 64, and 19% are age 65 to 84. And nearly 1% were over the age of 85, and that's more than 1,800 people. Nearly 2,300 Iowans have scheduled an appointment after qualifying for testing, and even with a soft launch at the first test site in downtown Des Moines, we have tested 874 Iowans since Saturday. At this time, the Des Moines site will continue to be open Monday through Friday from 8 a.m. to 6 p.m. Today, the second Test Iowa site opens in Waterloo at Crossroads Mall, and you must have, again, completed the assessment, qualified for testing, and scheduled an appointment to be tested. Remember that when you're going to the Test Iowa site after doing the above, bring your QR code that you received via email to your appointment, because that's how we match your test samples and results to you. And next week, we'll be opening 2 more Test Iowa sites in Woodbury and Scott counties. Test Iowa is part of our solution it's our solution for large-scale testing for Iowans, but we are also expanding testing capabilities for essential workers. Strike teams are now conducting surveillance testing using both diagnostic and serology tests for employees who work in long-term care facilities and in areas that with widespread virus activity. Again, by proactively testing, it's another measure that we can take to identify, isolate positive cases early, and protect our most vulnerable long-term care residents. Last week, we had 315 long-term care employees in Tama County who were tested, and today we have a long-term care strike team in Muscatine County that will be testing 120 employees from 6 long-term care facilities in the area. Strike teams will also use Test Iowa sites to conduct surveillance testing of long-term care workers in surrounding counties, allowing us to efficiently assess and test more of the essential workers in a timely manner. Additionally, we are providing testing supplies to a number of long-term care facilities across the state so that they can test their staff and residents when a positive case is identified in the facility. Our ability to significantly expand testing, case investigation, and tracing puts Iowa at an advantage. It's these tools that will allow us, like I've said, to track the virus activity across the state, not only from a macro level, a state level, but all the way down to a county, community, and even a zip code. As I mentioned yesterday, with increased testing, we're also expanding our case investigation teams. Today, I've asked General Correll to provide an update on how the Iowa National Guard is engaged in this effort. General?
Thank you, Governor. Good morning, everyone. As of today, the Iowa National Guard has 880 soldiers and airmen on duty supporting a variety of missions across the state of Iowa. These missions include PPE distribution. We have delivered this from day one, from the crisis starting. These critical supplies have gone to every county in the state multiple times. We're providing administrative and logistical support to the Test Iowa sites in Des Moines and starting today in Waterloo, with additional site locations coming soon, as the Governor just mentioned. We are transporting test kits and samples from multiple testing sites to the State Hygienic Lab. We continue to support the regional medical coordination centers across the previously mentioned 6 locations within the state of Iowa. Today, 2 new missions have become operational this week. We're providing soldiers and airmen to support the Iowa Department of Public Health with call centers for COVID-19 mapping across the state. Currently, we have 150 soldiers and airmen assigned to support this mission at call centers located at our National Guard facilities in Sioux City, Cedar Rapids, and one on Camp Dodge, with 50 of our men and women at each of these sites, coordinated with the Iowa Department of Public Health. The Iowa National Guard members supporting these missions have been thoroughly trained by public health professionals to gather and properly handle personal information required to determine potential COVID-19 exposure. The Iowa Department of Public Health is the lead agency in this effort, and all information provided is for the sole use by public health professionals. The Iowa National Guard will not retain or use this information in any way. These soldiers and airmen are assisting the Iowa Department of Public Health in efforts to contact Iowans who have tested positive for the virus in order to help identify other persons and places that may have been exposed. This will enable public health professionals to help prevent the further spread of this virus. The second new mission is providing manpower and distribution support to our regional food banks across the state of Iowa to help ensure all Iowans have access to food. We're providing up to 25 Iowa National Guard members to help support 6 regional food bank networks across the state. Our personnel will help unload trucks, sort food into carts, and assist with boxing, sorting, and distribution of food at these various locations. We are Iowans helping Iowans. We're neighbors helping neighbors. We are your Iowa National Guard. We're honored to support the people of Iowa during this challenging time. Thank you.
Thank you, General, and we're so grateful to the Iowa National Guard and your soldiers and airmen for providing the resources that we need during this critical time, and we're very, very appreciative of Iowans helping Iowans. So in closing today, I again want to say thank you to the nurses and other medical staff working at the Test Iowa sites, the from the Department of Human Services, the Department of Inspection and Appeals, who are part of our strike team, and the Iowa National Guard servicemen and women who are supporting them and helping expand our case investigation capacity. You're providing an important service as we work together to get Iowa on a healthy path forward. We couldn't do this without you, so thank you. And good luck to the Test Iowa team in Waterloo today, and with that, we will open it up for questions. Yep. So that's a snapshot in time, and first of all, I appreciate all the work that went into the model, and just like the model and the recommendations that they put together and the IHME model that Washington put together, there's a wide range of outcomes and recommendations. And so we are able, with the additional testing capacity, with the mitigation efforts that we put in place, and the way that Iowans responded, we were able to flatten the curve. We were able to mitigate the impact on our healthcare resources, as well as not overwhelming our healthcare facilities. And so at this time, which, on a daily basis, we're learning more, and it's rapidly changing as we're gathering information, we're really able to look at things on a case-by-case, real-time basis. And so I think it makes sense to start to loosen up in areas that have seen little to no virus activity, and to do it in a responsible manner. So it's not sustainable for us to continue to lock the state down. We need to start to open it up in a responsible manner in areas that we feel we've seen a stabilization and a downward turn, and some of the other things that we're looking at to start to open them up. We'll monitor it, which we can, and see how the state responds to lifting some of the mitigation efforts and start to move forward. So, we're continuing, I believe, to do it in a responsible way. I think you heard me say that 93% of the positive cases are contained within the 22 counties, so we're not seeing that start to move out. Yesterday, it was 96% of the positive cases were in the 22 counties. That's why I didn't open it up statewide, that we decided to do it, on a county-by-county basis, and we're going to continue to reevaluate every single day and make informed decisions to protect the health of Iowans, but also the livelihood of Iowans as well. When we look at our unemployment claims, we look at the increased food insecurity that we're talking about, when we look at the increased mental health concerns that we're having, and just from substance abuse to domestic abuse, there are a lot of criteria that goes into the decisions that are being made. And so we're going to continue to evaluate that and move forward. Well, so I said we'd look again in May 15th. I believe we were ready. I wouldn't have moved forward if I didn't think we were ready. In fact, let me give you an example. So we just lifted and brought back online with specific requirements elective procedures. I was on a conversation with the president of the University of Iowa, Suresh, and Brooks Jackson, making the case to us through all of this why they felt that they were at a place with responsible measures put in place to bring back elective procedures. And so that also came out of the University of Iowa and was a recommendation based on the numbers, based on what they were seeing with vents and ICU beds and their ability to manage the COVID-19. They made the case to the team that they recommended bringing those back online. And with the recommendations that we put in place, looking at the RMCC regions, demonstrating what we've been doing to Iowans on a daily basis, we did have the capacity to very carefully start to move in to opening elective procedures. So that is how we're going to have to manage COVID-19 as we move forward. I didn't just rip the Band-Aid off or flip the light switch. We're doing it in a reasonable phased-in approach. We'll continue to look at the data, and we'll continue to work with Iowans. And I believe in Iowans, and I know they will do the responsible thing. So if they're sick, they're going to stay home. If you're a vulnerable Iowan and you have underlying conditions, nothing has changed. You should continue to stay at home as much as possible. Take all precautions when you leave the house, social distance, wear a face covering, and really be aware of what your surroundings are. So I think we've moved forward in a reasonable manner to start to open Iowa up, which is something that we need to do.
And do you plan to attend in-person church services or farmers markets?
I don't know, but isn't it a wonderful thing? Isn't this great? Iowans are going to decide. Churches are going to decide. It's not a mandate. It's an option. So we have some that are going to continue to stay closed, and that's wonderful because they've provided opportunities to their members for online services. We have maybe some services in smaller communities that it's a smaller congregation. They're going to social distance. They're going to make a combination so that their congregation feels safe about coming. But that's a decision that Iowans will make and religious services will make across the state. I'll probably continue to still go online. Well, in fact, I think my church is continuing to stay online. That's a decision that they made. That's worked out really well for us, and I've been so appreciative of that. So that's probably what we'll continue to do. I love what the Downtown Farmers Market is doing. They're doing it virtually for the first several weeks. I think that's great. Some of the other farmers markets are, like for Sioux City, they're reducing, adding additional sanitation, wash stands. They're limiting the number of vendors, and so we can do this. We just have to do it together. We have to be responsible in how we move forward, and if Iowans continue to do that with the guidance that the Department of Public Health has put in place, I think together we're going to continue to move forward and get things eventually back to normal.
Governor or Sarah, which parts of the U of Iowa report did you disagree with?
Thank you, Chris, for the question. I wouldn't say, a model is a model. It's a forecast. It's an estimate of what we might see. And I think that one of the things to understand about that is we do, as the governor said, we appreciate the work that the university has done in providing that information to us. As the governor has started to open things up in a few counties, you'll notice that social distancing and a lot of the guidance that we've already provided, they're part of that reopening. And, so Iowans who are most vulnerable, they need to continue to stay home. That's consistent with the guidance that we've provided. And as we do look at reopening, the guidance from the Department of Public Health maintains all of those recommendations related to social distancing. And you'll see that in the guidance that's been posted, not only by our agency, but by other agencies as well, including DIA, for example, as it relates to restaurant reopening. So.
Okay.
All right, we're going to go to Rod at the Gazette.
Yeah, thank you, Governor. Since Iowa still hasn't hit the apex of its positive COVID-19 cases, and I'm interested in an update from Sarah where the projections for the peak currently stand, when is the soonest that the legislature should consider returning to Des Moines since Polk County continues to be a leading hotspot?
Yeah.
And should there be limited access to the Capitol building when the 2020 session resumes? The legislative leaders today said they would look to the governor and health officials for guidance. So what's your guidance?
Well, so I think, and we talked to the leaders as well, so I think, that as we're seeing, Polk is one of the 22 counties, and so we're looking at the data on a daily-by-daily basis, on a weekly basis, so this is through May 15th, so I think, by May 15th, we'll have additional information. We'll kind of see where we're at with some of the expanded testing that we've been doing, and then we'll continue to reach out to them and make those decisions going forward. But I think right now what they're saying is they, since they are still, the additional restrictions still apply to Polk County, that we'll continue to wait and see what that looks like by May 15th. I don't know if you want to talk.
Oh, yes, Governor, thank you. So I'm writing more on the meatpacking industry, and I see that the President has issued his mandate. And I wonder may be compelled to work or lose their jobs? I'm just curious if you know how that's been working.
Well, so,
Thank you.
oh yeah, thanks, David. I appreciate the question. I'm actually going to be on a call with the Vice President right after the press conference today to walk through some of the specifics. We've tried to be a partner throughout this entire COVID pandemic, working with our processing plants because it is critical infrastructure and they are essential workers, and we need to make sure that we can keep them up and running to keep the nation's food supply flowing. But I think, you know, there's a lot of things that go into that. It's keeping the facilities open, but we also have new guidance now from CDC and OSHA for the processing plants that will be extremely helpful. It's making sure that we're providing adequate PPE, and testing is a big component of that. So we have been very aggressive working with our processing facilities, doing a lot of outreach, walking through what the guidelines from public health has been from CDC, and now with the new OSHA guidance as well, to make sure that they are working very hard to do everything that they can to protect the workforce, and then and provide the adequate PPE. And then we are not only doing surveillance testing with diagnostic testing, but we're also using serology testing, and we'll give you an update tomorrow on that. We're really leading the country in providing both, so we can get some sense of the outbreak, do the case investigation and the contact tracing, so that we can understand the scope, and we can understand that if it's asymptomatic and they test positive, the number of days that they need to stay home. If it's positive and they're not experiencing any symptoms and they've gone the 7 days, 3 days without a fever and not taking any medicine, then we can get them back in the plant sooner too. So it helps us make sure that, and give some confidence to the workforce as well. So it helps not only keep the processing plants going, but helps us identify the scope and really make sure that we're providing the workers that they need so that they feel comfortable working in a safe environment.
Carolyn, go ahead.
Good morning, Governor. A two-part question. First, you said just moments ago that Iowa is starting to flatten its curve, and I'm seeking some clarity on that statement, considering Sarah said on Friday that our peak is still a few weeks out. And secondly, you touted the RMCC regions as key parts in your framework to make decisions about state policy regarding COVID-19. So I'm curious why the region approach wasn't taken with the reopening of the state, and if you could offer some insight about how that regional approach is working going forward.
Yep, thank you. Those are good questions, and I'll try to clarify that just a little bit. So when we first started experiencing COVID-19, which I think the first 3 cases were on March 8th, it seems like years ago, but it's not actually been that long. As we start to understand the scope and to see what we were dealing with, we went from community spread to substantial spread. Do I have those right? Are those the two? And as we moved into substantial spread across the state of Iowa based on the numbers that we were seeing, we started taking action and putting mitigation efforts in place in a very targeted approach. And the mitigation efforts were put in place so that we would slow the spread, protect our most vulnerable Iowans, start to manage our healthcare resources to make sure that we had the PPE that we needed, to really begin to flatten the curve. And when I talk about flattening the curve, we put the mitigation efforts in place to do that so that we wouldn't overwhelm our hospital systems. At that point, they were talking from modeling back then about, significant number of deaths, significant number of hospitalization, the numbers of potential vent and ICU beds were off the charts. And so by putting the RMCCs together and looking at it from a regional approach, we were able to get hospitals and clinics to all work together within the region to better understand the number of ICU beds and inpatient beds that we had available, the number of vents that we had available, so that we could start to project, as we saw our numbers increase, the availability for all of the healthcare resources. And as we've shown Iowans for the last several weeks with the RMCC data, and you can go online every day and look at that, you'll see that they've been able to manage the resources. The number of hospitalizations have not been anywhere near to what the early models projected. And just like I said with the University of Iowa, they were able to make the case that they did have the capacity, even in the event we potentially saw an increase in numbers, to start to release some of those beds and start to open up elective surgeries. So those efforts were tied mostly to resources and making sure that we didn't overwhelm our hospital system. Now, since then, we have been able to bring on additional testing to collect additional data to use the assessment that Iowans are taking to really drill down and really manage and contain virus activity across the state. And so this allows us to more surgically go in and see where we're seeing hot spots, where we're seeing increased numbers, where we're not seeing stabilization, and where we're not seeing a downward trend. And so I shouldn't punish half of the state when we've got a significant spike in 8 areas. And we're gonna, we'll know more by next week as they walk through their 14-day cycle of testing, finding out who's positive, then they recover and are able to go back into the workforce. So, the data is changing rapidly. We have better access. It's in real time, and that really allows us to make decisions based on a county-by-county basis and not a regional basis. We use both, but now we're able to get a little bit more granular in the procedures and the mitigation efforts that we're putting in place.
We're going to go to the Carroll Times.
Hi, Governor. Looking at the data, Woodbury County in western Iowa, Sioux City has had a tremendous surge in cases in the past week and a half to more than 700, which I think puts it past Johnson and Lake counties now. What are you doing to stem the spread from there? How are you coordinating with states that neighbor Woodbury? And why do you think it's wise to reopen western Iowa when it appears significant community spread is just starting to begin here?
So we had community spread statewide, but so we're watching Woodbury County and we're monitoring it very carefully. As I indicated, we'll be doing a Test Iowa site there next week. If I can get in this weekend, we will. I just don't know if we'll have the logistics, to be able to do that. But if not, we'll get there Monday and Tuesday. We're also doing outreach to the long-term care facilities in the area too. We're working with the hospital system to manage and monitor, but the more tests that comes in, and with the Guard's help and the Iowa Department of Public Health, our local public health nurses and Homeland Security, we're able to start to do the case investigation and the contact tracing, so we can really, again, pinpoint where this is happening, where it's coming from, and how we can best move forward, mitigate it, and contain it within Woodbury County. But we'll continue to be watching the surrounding counties to see if there's any, overflow with that from the outbreak that we're seeing in Woodbury County. And again, that's why the information that we're able to see in real time and on a daily basis really can help us monitor that. And if we start to see some spread into the surrounding counties, then again, we can get in there sooner rather than later, start to hopefully do the contact tracing and contain it and prevent it from seeing some of the bigger spikes that we're seeing in some of the larger counties.
We're going to try and fit in 2 more. Dave Price, Channel 13.
Good morning, Governor. A couple questions about testing. Today's total tests are about 1,500 or so. You had talked about the ability to do 3,000 daily. Can you explain why we're not to that point yet? And then on the strike teams, they'll be in Muscatine, which I think is a week or 2 after the outbreak there with the long-term care centers.
Yeah.
Can you explain how you decide where the strike teams go and why they don't go to a place as soon or right after an outbreak is reported?
So we're ramping up as quickly as we can. So it's been a week since we've had Test Iowa, and so we're really starting to put, the testing capacity in place. We're starting to open up the test sites. We're using not only the Test Iowa, we also have access to some other companies that are allowing us to do some testing as well. So we're utilizing that so we can actually be even more proactive in getting into some of our long-term care facilities and starting to do additional testing. So I don't know, you want to talk about kind of how we decide the long-term care a little bit?
So we have been targeting for long-term care strike teams areas where we do see increased activity within the community. So as case counts have increased in some of these areas, like they did in Tama County, like they've done in Muscatine County, that's how we're making decisions about where those long-term care facility strike teams are gonna go. And I think what the governor has described in terms of the Test Iowa sites and allowing long-term care facility employees to kind of come to those sites in advance of the people who have had appointments. Those sites are also going to be going to areas where we've seen virus activity increase.
And Dave, the other thing is the number, those are the ones that we were able to process, but we have done a significant amount of testing that there's kind of a 2 to 3 day lag, 2-day lag right now. We're going to condense that and get that done quicker, but as we're ramping up, so that's some of the, I think, the reason that you see that number a little bit lower than it's actually lower than what is reflective of what we're actually testing. So you're going to continue to see those numbers, especially the numbers that we're testing, go up considerably as we, again, ramp up the system and get things in place. They have done an incredible job of really making that happen in a relatively short timeline, but we know that it's critical, especially it's such a critical component of us continuing to open up the state and understanding the activity of the virus.
Last question, Amy Waterloo Courier.
Thank you, Governor. You have put the demographic, the racial and ethnic demographic information for a number of inspections on the state, and thank you for that. Wondering if you would also provide that for the deaths in the state.
We'll be looking at that once we have enough mass in terms of numbers to be able to provide the information that way. So that was a terrible way to say that. But as soon as we meet the CDC standard for releasing that information, I think we'll look at providing as much information as we can.
Okay. Thank you.